My name is Penny Owens. I'm a diagnostic radiographer by background. I'm currently the Director of Allied Health Professionals for Derby and Burton University Hospitals NHS Trust. I started training as a 17-year-old, and I had all the usual aspirations, which I think most people who go into healthcare have, which is to make it better and to care for patients. And really that came into sharp focus about a year and a half later, when my gran, who I'd lived with for quite a long proportion of my life, developed end-stage breast cancer. It's a bit of a surprise for all of us. And in those days, it wasn't a great diagnosis to have, unlike now, whereby there is more opportunity for treatment. She didn't really have that. And what she did experience and what the family experienced was, I would say, more of a remote scientific profession and not patient-focused level of care, and that really slapped me in the face like a wet fish. And I can remember thinking, no patients in my care or within my sphere of influence are going to have a similar patient experience, and that has really been what I call the golden thread throughout my career. What I would say to anybody that's going into management, and there are various forms of management. There is operational management, there is project management. There are various forms open depending upon what organisation you happen to be working for. But I would say that really hang on to your clinical reality, your clinical passion. Why are you here? Because that voice, that passionate voice, is always heard. Even though sometimes the medium, that translation medium, is imperfect, if you're trying to understand how to speak management, don't give up. I used to go home, after having been given some assignments on the MSc, I used to go home, have a bit of a cry, and then think, no, I'll be okay, and get on with it. And you do. And before you know it, you're actually speaking that new language. You're actually being able to deliver and enhance that clinical passion that you have and make your voice heard and actually make a difference to your fellow professionals, but most importantly to the patient experience. The opportunities are endless. You have to make your own opportunities. You have to decide where you want to be and what message you want to deliver. I never thought for a minute that I would end up as a director of the NHS. Who would have thought it? I wouldn't have thought it 2 years ago. The answer is believe in yourself. Believe in yourself, believe in why you are here, and it will happen. That passion will come through and it will win out. People will recognise it. It's very important. It's vital for us as AHPs to be able to bring that different service delivery and that different view to patient pathway. Vital for the future, and good luck with it.